Welcome to another episode of Living Healthy. I am Victoria Adebobola. Today, I will be talking on asthma. I would be exposing us on things that are needed to know when it comes to asthma. What is asthma? What are the signs and symptoms of an asthma patient? What are the causes of asthma? And what are the treatments and management of asthma? But before I proceed, let's go for a short break. Stay tuned. Welcome back. What is asthma? Asthma is a respiratory disease. Asthma is a disease that affects the organ known as lung in the human body. Asthma can be also called bronchial disease because it is a disease that affects the bronchi of a lung. Asthma is the obstruction or the inflammation of the human airway, and this is described or this is characterized by recurrent and reversible obstruction of the airway due to the inflammation. When there is inflammation of the airway becomes narrow and swell, leading to difficulty in breathing and excessive secretion of the airway, which triggers coughing, wheezing, and shortness of breath. To some people, asthma is just a minor problem, and to some, it is a major problem which can interfere with daily activity and which can also cause a life-threatening asthma attack. What are the causes of asthma? Medically, it is not clear why some people get asthma, but it can be traced to some environmental and genetic conditions. What are some of these environmental conditions? There are some environmental conditions that tend to trigger asthma or that tend to cause asthma, such as dust, such as pollen, such as when there is influx of the movement of the acid from the stomach back into the throat, which is known as gastroesophageal reflux disease. Then there are also genetic conditions that causes asthma. That is, when we trace it to the phenotype and the genotype of a parent with their offspring, there is higher probability of an asthma condition. What are the factors that increases one's chance of developing asthma? First, being overweight. An overweight person is prone to developing asthma. Having a blood relative with asthma, being a smoker, exposure to exhaust fumes, exposure to chemicals, exposure to pollens and dust, and exposure to cold weather increases the chances of developing asthma. What are the signs and symptoms of asthma? There are various signs and symptoms of asthma, but I will be discussing about the major ones. These are difficulty in breathing, chest pain, cough, and wheezing. Cough is a major symptom of asthma, and this is always a dry cough that occurs especially at night, including during exercise. During exercise, this cough tends to be chronic. Then we have difficulty in breathing, and this occurs most especially at night. And we have wheezing. Wheezing is just a short form of difficulty in breathing. Wheezing is when there is inconveniencing in the way someone breathes. Other symptoms of asthma include throat irritation, chest pressure, rapid heartbeats, anxiety, and early awakening. What are the treatments of asthma? Medically, asthma can be managed, but in rare cases, it can be treated, and this includes self-care and bronchodilator. Asthma can be treated or can be managed by rescue inhalers to treat the asthma symptoms, and it can also be managed by controller inhalers to prevent the symptoms. Chronic form of asthma can be managed by long-acting inhaler, which enables the airway to be opened in order to improve the breathing. Aside from bronchodilator, there are also other forms of medication such as steroids and anti-inflammatory drugs. Bronchodilator, steroid, and anti-inflammatory drugs help to manage asthma or help in the treatment of asthma by reducing the inflammation, by keeping the airway open, and by preventing stiffness in joints and muscles. Let's talk about the self-care. In order to manage asthma, in order to treat asthma, there are some basic techniques. We call them self-care for anybody suffering from asthma or from any asthma patient. What are the self tips for asthma patients? Quit smoking or avoid smoking. Watch what you eat. Get enough water to keep hydrated. Manage the exposure to allergens. Then minimize the exposure to sprays, exposure to dust, and exposure to every other form of chemicals. Then do not forget to keep your inhaler at hand. The management of asthma determines if it kills or it doesn't. So being an asthma patient, it is advisable to always go for a checkup, take use of your medication, ensure you carry out the safety that I have mentioned earlier, and by doing all this, it is very possible for you to manage asthma, and then long life is guaranteed. We have come to the end of this episode. See you next time on Living Healthy. I remain Victoria Adebobola. Thank you.